Good morning, Milwaukee. How's everybody doing? It's been a minute, but we're back again with Your Health and You. I'm joined in studio with my friend, Mr. Ellis, Mr. Willie D. We are here today talking about heart health. And virtually, we have my friend, my sister, Miss Erica Sinclair from Health Connections. She's been busy. She's been busy. But today, we're going to talk a little bit about heart health and the connection to chronic illnesses and also looking at the prevention side. And there are a lot of activities that are going on in this weekend alone. But Miss Erica has been busy for several months and years, matter of fact. But just on this particular topic, we've been doing this for a couple of months. But first, I want to introduce everybody to Mr. Ellis, one of our health griots, as you may remember from other pieces. Mr. Ellis is a health griot with the Medical College of Wisconsin Cancer Center Community Outreach and Engagement Team. And I want him to tell you a little bit about his story and what made him become a health griot. Good morning, Mr. Ellis.
Good morning. My name is Willie D. Ellis. I'm a prostate cancer survivor. I was diagnosed in 2017, July of 2017. At that particular time, I was one of those individuals who every year did my physical, but however, my physician never told me that I needed to take a PSA. So at the age of 67, as I went in and my doctor asked me, had I had my PSAs checked? And I was like, have I had what? And she says, your PSA is for prostate. And I says, no, no one has ever asked me to have that done. So she says, well, today I'm going to do a blood test. And so we did the blood test. That was like about 9 o'clock in the morning. So at about 4 o'clock that afternoon, she called me and she says, Mr. Ellis, I need you to make an appointment in the next couple of days to come back. And we want to talk about your PSAs because they are awfully high. And I was kind of stunned because I was kind of stunned in a way, but in a way I wasn't, because I have family that have prostate cancer. I have 2 uncles and several cousins and so forth. So I was familiar with prostate, but I never, because they did the old fashioned way where they invaded your privacy. So I just want to tell the people that's listening, you don't have to do that anymore. All you have to do is have a blood test done, and then they can check your PSAs. But moving forward, so then I went to have a biopsy done, and the biopsy revealed that it was cancerous in several different areas. So then I went and had imaging done and so forth, and they made sure that it hadn't spread it into my lymph nodes or anything like that. So then my wife and my daughters, we all sit down and talked about, okay, what is it? How do we want to address this? My doctors were recommending no surgery because at that particular time, they said that I had aggressive prostate, which means that it needed to be taken care of within the next 90 days or whatever. So my choice, basically, after all the tests and so forth, and my family and I talking about it, we decided to just do radiation. So I did the radiation for 8 weeks and 5 days a week. And after that is I chose the hormone shot. Hormone shot, basically what it does is it slows the testosterone down. So in other words, it slowed the aggressiveness. So I went from a 9 down to a 0.000. And I can tell you presently that my PSAs is at a 0.21. So it's normal basically for it to gradually come back up, but it's been stationary like this for the last 2 years. And so I guess I would say that I'm cancer free, but at the time, some of the things and some of the effects sometimes that happens is you end up having hot flashes with the hormone shot. So I know you women out there. I know basically what hot flashes mean. So I know what that means. So I apologize for telling my wife that, why you got the cover pulled off of me. So, but so now what I do and the reason why I became a health griot, well, let me back up. Um, During my life, basically, I've been an operating engineer, which I'm a retired operating engineer. I also was a business rep organizer, to whereas I helped apprentices and people negotiate contracts and solve problems and so forth. So I guess I'm one of these individuals that enjoy helping others. So I work right now at WRTP Big Step, Wisconsin Regional Training Partnership, where we get people into apprenticeships, and we also help people get their high school diplomas and so forth. So that's my reason every day for getting up and going and helping those people. So what better way to get the message out about prostate cancer? What do you need to do? You need to go, you need to get your checkup done. And like I said, it's simple, a simple blood test. But don't just depend on uh, prostate. There's other issues. So what we need you to basically do is go out and have your checkups. There's free clinics that you can go to. There's also free seminars that we have, basically where we have an individual there that can do your PSAs for free. So get involved, take care of your health, and that is one of the most important things that I can say to you today.
Awesome. Thank you, Mr. Ellis. Now, you said you retired from operating engineer,
Yes.
but you did. I need to find one person who retired right. You're supposed to retire, find a beach.
Well, let me explain this. Let me explain this. My wife always teases me and my kids, and even my coworker said, "Mr. Ellis, you're supposed to be retired." I am retired officially from operating engineers.
Okay.
But I felt that I needed to do other things to help others. So
We appreciate it.
by doing with Health Griots
Mhm.
and WRTP Big Step, helping young people get into the trades and so forth. Because when I got into the trades, there was nobody that looked like me in the trades. Okay,
Yeah.
I just to give you a little bit of background, I joined operating engineers in 1970.
Okay.
Okay, I
Okay.
was the youngest black journey operator that Local 139 had at that particular time.
Wow. We're
I
sitting
didn't
with
have to go
history.
through. I didn't have to go through the apprenticeship.
Oh, okay.
So I
Okay.
went directly as a journey operator.
Awesome.
Yeah.
Well, I know several, my nephew included. He wants to be work on airplanes,
Mm-hmm.
and at first he wanted to be an electrician. And trying to find those apprenticeships for those type of things is difficult. It's hard. So having people like you is very, very important. And I think the other example that you set with being a health griot, prostate cancer survivor, thriver,
Yes.
as we call it, you're able to tell that message that this is not as many people think. Once you hear the word, the big C, once you hear cancer,
Right.
it's over. And that's part of what the work that griots do, is to say, the prevention is important, and that this is not, things
Yes.
aren't over once
Yes, that's one of the things that basically that we try and make the and get the education out there about prostate. It's not a death sentence.
again.
They have found a cure for it. So it's when I look at it and when I think about it, and like I said, one of the most important things about any cancer, any illness, you need family support, and that was basically what I felt that I had. Was my wife and I were able to talk about it. My kids and I were able basically to talk about it,
Mm-hmm.
and we still talk about it.
Good.
And we talk about
Good.
what it is that we need to do and why am I part of the Health Griots, because I want to get the message out to other people. I want to make sure that they understand there is a source uh, to help. In other words, there's also groups that you like the Health Griots that you can just, if you want to talk to us one on one, that basically maybe you don't want everybody to know your condition and you want somebody to talk to, then that's basically what we are here for, is to get that message to you and help you understand that life goes on.
Definitely.
There are some restrictions, but those are things personally that you have to come to grips with. And if you have a partner and so forth, don't be afraid to sit down and tell your partner, okay, this is the issues. What can we do? How can we, you can do a simple thing as take a walk out
Hmm.
on the lake, hold
Hmm.
hands, you just bond with each other.
Right.
You know,
It's
those are
so important.
those are very important
And
things.
family is so important. And part of what you were saying, which I think part of the thing that the health griots do is that you are about health, men's health in general.
Yes.
um, and it leads into family health, but leading by that example of being healthy. And that's one of the reasons we have my sister here, Erica Sinclair. When you talk about the treatment that you received in 2017, your body had to be ready for those treatments, and you had to be, the doctors had to determine that you were healthy enough to be able to withstand the radiation. And part of that health that they look at is your heart health.
Yes.
And Erica, Erica Sinclair, I want you to tell us a little bit about Health Connections and how in the world you started doing this awesome work around.
Yes, ma'am. Can you all hear me okay?
Yes, ma'am,
Yes.
we sure can.
Excellent, excellent. Thank you so much for having me. I'm Erica Sinclair. I'm the CEO of Health Connection Incorporated. I started 10 years ago. So it's our 10-year anniversary. Yay.
Yay.
We're an independent medical clinic. We do primary care, HIV care as well, and STI care and treatment. And similar to what Mr. Ellis said, a lot of it is just letting people know the education around these things, and that primary care is just that, it's primary, and
Hmm.
it's primary for your health, and you should have a what they call a PCP, a primary care provider.
Yes.
It could be a nurse practitioner, a doctor of osteopathic medicine. It could be a nurse, an MD, but you need someone that knows. Even if you just see them once a year, they know what's going on with you. You get that one checkup, and then during these checkups, a lot of people find a lot of things. I was just online with someone who I was on a panel with Senator Baldwin not just a couple of weeks ago. She
Oh.
befriended me, and she found out she had cancer. She
Mm.
would because she went to the doctor after our visit, after
Mhm.
our appointment, and so she found out she had cancer, and she is starting her process. But it's really interesting because of course, she shows up strong, and we show up strong
Yeah.
out in person. But then when the reality is that we still have to go get ourselves checked, because a lot of things that happen in our bodies are silent. They're
Yeah.
not something that actually shows up and says, "Hey, I got you got cancer." It's things that if we do our regular checks, regular
Mhm.
health checks, is how we find out that we have things like this. So I commend Mr. Ellis for getting his self checked out, making sure that he followed up, and that family support, to your point, is so important.
Mhm.
In our clinic for Health Connections, I started Health Connections because my background as a scientist, I'm a microbiologist by training. I'm also a clinical laboratory scientist, and I did work at the Centers for Disease Control. So being in a global situation like that, I worked a lot with infectious diseases and around the world. And so when I came back home to Milwaukee, born and raised here, I said, I really want to make sure that I can have an impact on my community. The Sinclairs were known for being involved in the community intentionally. It's how we grew up. It's part of our DNA. And so when I had an opportunity to actually start a clinic after being a health care administrator at the health department at local large health system, as well as FQHC here. When I got an opportunity to create my own clinic, I did. And part of it is so that we can spend more time with people, more than 15 minutes, because you
Mhm.
can't really get a lot done in 15 minutes. So I intentionally created, the clinic so that we can have more education, more relationship building with providers and patients, and be able to really understand what's going on with people. So these days, a lot of things are talked about, where the social determinants of health, and find out what's going on with people, get to know people more, to see what barriers are they actually coming up against in
Mhm.
order to be able to actually even get here to the office to see us, let alone, take care of themselves every day. So that becomes a part of the conversation. And that's how we create intentional, individualized, comprehensive plans, health plans for people, because everybody
Mhm.
can't do all the things. If you're unhoused at this moment, then we can give you certain medications that need refrigeration. We need to give you a different
Yeah.
version. But in the meantime, we actually, as a clinic, we help you figure out the housing situation. So then now we can give you the optimal medication, because now we've helped you with your housing issue. So we do more than just regular care. We make sure that you get plugged in to the other things, because for us, health is comprehensive. It's all the things. So we just try to figure it out. So when it comes to heart health, there's a CDC grant that came through the state. They asked us, myself and Dr. Yvonne Greer, who's a registered dietitian, and I'm a public health expert and official here in Milwaukee. I'm part of the City of Milwaukee Health, Board of Health. And they asked me, and I have a medical clinic, so it was a good match there to have me lead Milwaukee Heart Health Learning Collaborative. And so what we do as a Milwaukee Heart Health Learning Collaborative, there's one place, it's a census tract 1860, that is the highest level of uncontrolled hypertension in the state of Wisconsin, in the entire state. And it's right here in Milwaukee. It happens to be in the area that's right outside of Thrive on King. It's right in, Thrive on King is in that space. Right on 3rd, it's like Walnut, Center, Holton, and then the highway. And so that area is really the highest level of uncontrolled hypertension in the entire state of Wisconsin. So our goal as a collaborative is to work together to figure out ways to help increase that, decrease that number, because we don't want to be known for yet another high, out of control issue, especially with something as personal as your health. So that's how we got involved with heart health. And we have providers of care, direct providers. We have community health workers. We have health clinics. We have insurance companies. We have Milwaukee Food Council as an example of a community-based organization. We have a lot of different people who come at this issue from different aspects, who are definitely rooted in community, who are at the table helping to figure out what this, how to get care to people, which is why we're doing our Move Every Heart Milwaukee heart health fairs. We're doing them in 5 different churches. We have 5 different stops. Tomorrow, October 4th, will be our last stop at Calvary Baptist Church. We're excited about that, from 12 to 4. And we have a panelist from Versity coming to talk about organ donations and their experiences. They're local Black Greek leaders in Milwaukee who will be there talking about their own personal experience. And they are actual organ recipients. So that's going to be great to hear from them. We're also going to have the other stops that we had, which is Christ the King Baptist Church, Unity Gospel House of Prayer, Ebenezer Family Worship Center, and Evolve Church. And they will be representatives will be there, and they'll be getting a special thank you for being host sites. And so we hope that you all join us. It's free and open to the public. 2959 North Titonia Avenue. That's where Calvary is located. And that's all the things.
That's a lot.
I know.
It's a lot. But the history behind the work, that 1860 census tract, that is something.
Yes.
That is, and normally one of the things that you and I and many others know is that when you have something like that is, I don't want to say simple, but it somewhat is simple, as controlling your blood pressure, that is uncontrolled in a census tract. That means within a targeted area that you described, that is just compounding other issues, because if you don't have access to care, if you don't have health coverage, if you don't have the time, if you don't, you're not able to carve out that time to develop that relationship that you talked about with the primary care provider, your blood pressure control can lead to so many other issues, specifically as you related it to heart health. And that's really critical, I think, people to understand. And that's why I love the opportunity to be able to bring this out to the community so that people are aware. And again, you said that's on King Drive, and then Walnut, the freeway, and then what's the other one?
Holton Street.
Holton.
Mm-hmm.
Okay. So within that area, we know who lives there. Primarily, we know who's there.
Yep. And it covers 17 neighborhoods.
Wow.
And so that, Milwaukee has all these named neighborhoods. It's 17 named neighborhoods that are involved in that space. And we know that this is a part of gerrymandering. This is a part of the highway being built and breaking up Bronzeville. Mm-hmm. This is very much it's very targeted, and there's a very and it's hard access to healthy foods that you can afford consistently. I'll say this because this is just something I just keep. Every time I go down Third Street, I look at how did KFC? How's that still there?
Yeah.
How's KFC still there? I'm just saying, like this, like it's probably the oldest restaurant on the street.
Yeah.
That
Yeah.
speaks volumes. That
It does.
speaks volumes.
It
It
does.
also is that we have a lot of apartments. There's a lot of apartment living and senior
Yeah.
apartment living. And so
Yes.
that actually really contributes tremendously to the number of people who have uncontrolled hypertension.
Yes.
And so our part of our goal is to get to know these people so that we can understand what are the barriers to you getting this care and getting it to, to making sure that we can get you under control. And we're just trying to understand so that we can figure out, because we want you all to come to the table with us to help us understand, because we don't want to create an intervention and it's not working. Like it's because it's not, you are not involved. The people that are the most impacted are the ones that have the answers. We just want to help you, give you the resources to actually get it done.
Definitely. And I think one of the things that we do, collectively, you, I, Dr. Greer, so many others, is that we are more looking at the assets that are currently in the community. And so one of those things that you did, one of the strongest assets that people can easily identify is our churches. And so that's why, that's one of the reasons why you did those partnerships there that was so critical. But those assets are really, really important.
Absolutely. And these churches have been here. These are churches that are established. These are ones that have deep histories with the community already. These churches are involved. When we have these events, they come. They are a part of it. They are part of making sure that people know about it, and it's important. And these are resources that are free to people. Like
Yeah.
these are, you get your blood pressure screening, of course. This week you're going to have flu shots for free regardless if you have insurance. You can
Wow.
get your flu shots for free. We have the mobile unit coming from Outreach Community Health Center. The
Oh,
med students will be there, so we get to help them get their education. I'm big on workforce development for healthcare, so that meets that piece of it. Other community resources and giveaways. Dr. Greer will be there, helping you to understand what you like to eat and how you can make it healthy. It's very, very helpful information. We are very intentional
mm-hmm.
about making sure that whatever we do for services, that they're actionable things.
Yeah.
We very rarely have someone with a table with just information. We're
Mhm.
about signing people up for things and getting them involved and getting in their families, connected and things like that. So we hope that you take us up on our offer. Our program starts at 12:30, so you can get there a little bit earlier than that, so that we can go ahead and we have some special gifts to give to the host sites, and we would love for you to be a witness to it.
That is awesome. That is awesome. Well, we're going to take a quick break, and we're going to come back with my guests, Miss Erica Sinclair and Mr. Willie D. Ellis. Today, we're talking about heart health and the relationship to cancer prevention and cancer treatment. And we will see you on the other side. Welcome back, family. We are here with Health Griot, Mr. Willie D. Ellis, and with my dear friend, both of them are friends, Erica
Well, thank you.
Sinclair. Erica Sinclair with Health Connections. And we were talking, I would be remiss, and family, charge it to my head, not my heart. To this month, October, is Breast Cancer Awareness Month. And everything that we're talking about is focused on cancer awareness, but we do want to acknowledge that this is Breast Cancer Awareness Month. We'll be talking a little bit more about that in 2 weeks we're bringing some information to you about projects that are going on. But I want to continue with Erica. You've talked about your program that's occurring at 12:30 tomorrow at Calvary, and everybody's invited out, um, and it's focused on heart health.
Mhm.
Mr. Willie D. Ellis is one of our prostate cancer thrivers, and treated back in 2017. He benefited from having a healthy lifestyle, being active. When his treatment started, he was he was ready to go through his treatment.
Yes.
But there's a correlation that you want to draw, Erica, with regards to uh, heart health and prostate cancer. If you could do that for us, that'd be awesome.
Absolutely. There's a fact that men with prostate cancer are more likely to die from cardiovascular disease than from prostate cancer itself, largely because there's shared risk factors
Mm,
like obesity, high blood pressure, diabetes, and smoking that drive both conditions. And so this is an important thing for, again, as we talk about lifestyle changes and creating partnerships with your primary care provider and your family to help you stay on track. And also, a lot of times when you do these lifestyle changes, you should really do it in a family situation. Like you shouldn't necessarily have to cook two different meals. You should have one meal and everybody be healthy. It's a part of while you're dealing with it. If you have prostate cancer, or any kind of cancer, like immediately, your family benefits from the prevention that you're creating, the preventive environment that you're creating by even introducing um, healthier lifestyles to them. So it really becomes a community. It can be a community way to prevent these kind of conditions, or at least decrease them. And if they do come, we want you to be ready with the relationship already established with your primary care provider, so that they can really walk you through this journey to successful outcomes.
Mhm.
definitely. And I have to point out there. I'm able to see because of technology. I can see the comments, and Mr. Romel Brown mentioned you talked about why is there a KFC still on King Drive.
Yes.
His question is, why are the alcohol outlets still there?
Listen, that too.
Thank you.
They're all thank you. Thank you.
Mhm.
Thank you for joining me in that question. I have no answers. But that thank you for that question. It's the same. It's exactly it. And so why
Mhm.
can't we get healthy places like Pete's Fruit Market? Now we know food is and fruit and such is expensive. It
Mhm.
is. How can we help people with that cost? There's corporations. We have a bunch of Fortune 500 corporations that are around Milwaukee, Milwaukee County, things like that. Can you contribute ways to help have discounted situations in those spaces? Like there's ways to be cooperatively um, working cooperatively as businesses to help each other stay healthy, so we can have a healthy community. So I'm always about those creative ways of doing it, and I agree.
Mhm.
The alcohol, the bars, there's just a lot of spaces, but and I know that a lot of that is left over from historical. Historically they've been there. I get
Yeah,
it.
yeah.
There's also such thing as mocktails. I mean, there's just ways to be creative and still create that
Mhm.
community that those spaces allow. So thank you for saying that.
Yeah, thank you, Mr. Brown. Appreciate you. And I want don't you can definitely join in the conversation through YouTube chat, but I also want to invite you to join us live on the radio. That phone number, you can call in at 414-444-5253 or 414-444-5250. Tell us a little bit about your experience and what your questions are around heart health, and maybe what you're seeing when we talk about this census tract. Do you live in that area? Do you live within in that King Drive, Walnut, the freeway in Holton? And what are some of the things that you see within that community that might also, I mean, Mr. Brown pointed out um, the alcohol and
Mhm.
the correlation, the relationship between alcohol consumption and blood pressure. Erica, can you link that? And then even we know there's a
Right.
relationship between alcohol consumption and cancer risk. So can you thread those
Absolutely.
together?
Yeah. So the more, alcohol does it impacts your blood pressure, and there are people that in my life who um were alcoholics. They went to AA meetings and everything, and that's one thing that they could not get under control was their blood pressure, and that affects your kidneys. That affects every part of your body, really. But this particular person I'm thinking of, it affected their kidneys. They had kidney failure, and that was it. It took them out, and it was hard to watch it happen. And they had access to care, they had access to things, and they took advantage of it. But at some point, if you drink at that level for such a long time, your body just can't do it. It just your body is not built to manage itself that way. So it just didn't. He just didn't make it. But I know a lot of black men, especially, who have uncontrolled hypertension. Uncontrolled, their blood pressures are constantly high, and they are not necessarily in partnership with providers to help them get that under control. They may start the medication and not continue it. They may continue to eat the food that they shouldn't. I think everything in moderation,
Right.
right? Like if you like it, I love it, but you gotta, still be smart about how you deal with it. So it's a really hard thing. But yeah, having that blood pressure, that connection with the alcohol, it's a direct connection
Yes.
actually. And you just have to figure out ways to drink more water. I'm struggling with drinking more water. Even and not that's not even my issue. I'm with Mr. Ellis on the hot flash thing, but so he's trying to drink water. I'm like, I need to drink something to get this figured out. So that's what drove me to drinking more water. But we just got to figure out what part of your life, and when you have your family involved. And I so love the fact that you talked about your family's involvement and that you involved them in your conversation and in your plan, your health plan, Mr. Ellis, because family support, it changes things. It makes a
Yes.
difference, a big one, because those are who you are in those private times and those, you're not on stage, if you will, like those things, those times where you're just like chilling out and you can make them, you can slip up. And so to have a family member there to say, remember, we want you to be here with us longer, like, and it just makes a difference. It pulls at your heartstrings. I would love to hear from Mr. Ellis how he did more of how he did that and like what that experience was to involve your family in your health.
Well, well, one of the things that was important to me is it's kind of like a little story. Is my baby daughter was expecting twins when I was diagnosed with prostate cancer. So my mindset was nothing is going to stop me from watching
Mhm.
my twin granddaughters grow up. So I can say that uh, they'll be 6 years old February the 16th, which we call them my Valentine babies.
Mhm.
You know, so but the most important thing was with me was I came to grips with myself. In other words, I felt that I was going to beat this. That with my belief and my trust in God, that I was going to be here for a while. That nothing was going to stop me. I was going to do what I needed to do. So to expand on that, what happened was the medical college then called me and asked me if I wanted to be part of Men Moving Forward, which is basically a another program basically that I'm
Mhm.
still involved in.
It's actually a research study.
It's a
Yeah.
research study.
Yeah.
So basically, my coach, Coach Leonard Wilson, when I first went in, is he told me and I can laugh about it now. He says you'll be able to in 16 weeks you'll be able to do 50 push-ups, and I looked at him like, yeah, right. And so anyway, with the help with his training and so forth, I was able basically uh, to do 150 push-ups at one time. But getting back to my belief and my health, I changed my eating habits. Eating more healthy, exercising, and I can honestly say that I'm now a vegan. I do not eat red meat. I do not eat chicken. I do not eat fish, and so forth. So I make a lots of my own meals. I don't eat processed food, and processed food basically has chemicals, and those chemicals is used to preserve that food. So what chemicals it has in it, we don't know. I mean, I try to eat organic foods and so forth, you know. But the most important thing, and what I also wanted to say, is getting back to breast cancer, as like Ms. Neville said, is my mother was a breast cancer survivor. My wife is a breast cancer survivor. So I understand, and I had been around those conversations. I dealt with my wife having breast cancer 20 years ago. So it wasn't anything new, and the only thing with me is I don't understand why I didn't know more about prostate cancer. I guess I was more concerned and more working and didn't really think about it. I've always been a healthy individual. So, as some of our other individuals say, well, why me? I go to the doctor, I do everything that I need to do, and my kids, my daughter Jazz and my oldest daughter Felicia, said, "Well, Dad, you are human." So, as I now feel that I can basically, I believe, and I try to take care of myself, and I do what I need to do. And like I said, we have conversations about, each time I go to the doctor, just conversations about health and what we need to do. And my baby girl don't let me forget, because she's a radiologist, research person. So, and she got me to read about the different effects, what after I had my radiation and so forth, what some of the effects uh, could be, and so forth. So with me, I'm happy with myself. I feel basically that I've done those things, and I continue to do those things. And what I want to tell the public is, number one, come to grips with yourself. Is That's the most important thing. Understand that you must change your lifestyle to a certain extent. I've never been a drinker, so that part I didn't have to worry about. I might have one drink here or there, but I've never been one who drank a lot and so forth. Communication, getting to your appointments, make an appointment, talk to other people, find out where I can go to uh, get help. There is organizations out here, even like you said, with insurance. If you don't have insurance, there's places basically that you can go, and that I want to see people that look like us take advantage of that. You know.
Absolutely. And you're talking about the free and charitable clinics. Health Connections actually is one as well. We're actually a hybrid. We take insurance, and we also we don't have to take insurance for people that need to get immediate care. We're able to go ahead and take care of you as well. So we're part of the Wisconsin Association of Free and Charitable Clinics. And we are a clinic that if it's better for you to go to like Bread of Healing or one of the other clinics, we are in community with them as well. So we actually get people to where they need to go. And where they're going to stay long term. That's really our goal. We don't hoard patients. We're like, if it doesn't work for you, we can get you somewhere else. I do want to say two different things. We'll get you somewhere else.
Yeah.
One thing is Health Connection Incorporated does take United Healthcare, FYI. If you need your provider, if you need United Health, a new PCP primary care provider. I know a lot of people that go to Ascension, Wisconsin. They are not currently in network with United Healthcare. So if you need your care, even if it's intermittently from now until maybe they get their stuff figured out, just know the Health Connection Incorporated is available, 414-999-1099. We want to help.
Repeat
we want
that.
to help.
414
414-999-1099.
Thank
So
you.
that's one thing. Yep. And I also want to, I'm sorry, did you have a question?
No,
No, go
continue.
right ahead. Go right ahead.
So then I want to also mention that Medical College of Wisconsin, Health Connections Incorporated, and Wisconsin Diagnostic Laboratory have formed a partnership where we actually go out to the community, and Health Connections comes out and does PSA testing in the field. So we literally will test anywhere. I'm just that person. We actually going to be at the Fatherhood Summit that the city of Milwaukee is giving on November 1st. We will be there doing PSA testing. We will be there if it works out. We hope to be there with Medical College of Wisconsin actually doing a screening, hopefully, of a film called The Silent Killer. And it talks about prostate cancer. And we would love for people to come out and be a part of about a part of that screening, to be able to see it and then have a discussion with us. And you will be able to get PSA testing on site. So it has not been, that part has not been finalized. Erica, will be there doing PSA testing regardless. But hopefully the other piece of it can get worked out where we can actually have that screening and then the discussion afterwards. If we don't get a chance to do it there, we will be doing that, because we love we will have this happening one way or the other, because that's who we are and how we're built. I also want to make a quick comment about there's a clinical connection between breast cancer and prostate cancer. So the same gene that raises breast cancer risk, and you heard of BRCA 1 and 2,
Yeah.
BRCA 1 and 2, that same cancer rich gene in women can also raise prostate cancer risk in men. That's why family history matters for everybody.
And Erica, if you could
Because
say
if you
that
have
again
a
and speak a little bit louder
sure,
because your voice is a little soft. Say,
sure.
say that
Sorry.
again. So that
Um, so the same genes that raise breast cancer risk in women can also raise prostate cancer risk in
okay.
men. So family history matters for everyone. So think of it as if I had breast cancer, then my son will be at a higher risk for.
Mm,
Does that make sense?
yeah.
Yes.
Yeah.
And so that's why family history matters. And I
Yeah.
will say this as a Black woman and from a family, a large family, that we don't often know our family medical history. So
Right.
that really needs to be the movement. That needs to be a
Yeah.
movement in of itself, getting family history figured out. Because if
Mm,
we don't get that, then we end up setting ourselves up and our family members up, unintentionally for sure, but setting us up, no matter how you look at it, for not being able to get the best healthcare access possible. There's a huge risk, and there's a direct connection right there. So
yeah.
there's a connection between breast cancer and prostate cancer. There's a
Mm,
connection between heart health and prostate cancer. And this is
mm.
why we really have to get our men activated around their health. You need to get a full checkup on a regular basis, on at least an annual basis, so that we can make sure that you are here for us, because we need our men.
Erica, so true. So true. And we're going to continue on this theme. We're going to take a quick break. Milwaukee, I want you family call in that number 414-444-5253 or 414-444-5250. We want your questions. We want your thoughts. We'll see you on the other side. Welcome back, family. Welcome back. And I want to, if you didn't hear on the other line, well, first of all, come join the conversation. Come join the conversation. The number is 414-444-5253 or 414-444-5250. One thing, this is October is Breast Cancer Awareness Month. And my friend Erica from Health Connections, CEO and founder, and also nurse practitioner. While you're spouting all this education and all these preventative measures, we got to make sure people know you are a nurse practitioner and you've been doing this for many years. And as you said, your history and your background is you definitely earned it, as we like to say nowadays, for that DEI. You definitely
I do have to have a correction. So I'm not a nurse practitioner, but I employ them. But I've been around them long enough and run and administrative. So I'm a public health expert, but I've employed nurse practitioners for years, and I'm definitely with them when they're doing trainings and especially when they're talking to patients and stuff. So I learned a lot over the years.
She learned
30
a lot.
years. 30 years. I started when I was 2, but I'm 30 years. I've been doing this.
Me too. Thank you. Yes.
Very smart 2-year-old.
Very smart 2-year-old. Yes. So, but want to point out that the connection between the BRCA gene, which many of us have learned about when some like Angelina Jolie and the rest found out. So sometimes, and we had just had a community forum, if you will, around with one of our collaborating partners, Families Fighting Hereditary Cancer. And these are 3 sisters, 2 of whom have been diagnosed. All 3 of them have the BRCA gene, and they have all had genetic testing to be able to tell them that they had the BRCA gene. So they are what we call previvors. You take precautions before the diagnosis comes. And so they are all previvors. They're doing things to make sure that they are, as Mr. Ellis said, that they are around for their family members. But that relationship between the BRCA gene that leads to breast cancer, and prostate cancer, that's a recent finding. And what's so important about the research that's done and why that's so critical. But say that again. So I asked Mr. Ellis, as Mr. Ellis had mentioned earlier, his mother had breast cancer, and she was diagnosed around 55. So so as we know, as someone said in the chat, family history moment, with knowing that family health history, if you know the family health history, if my father passed away from prostate cancer, my biological father, but he was diagnosed when he was much older, and but if he would have known that his mother had breast cancer in her 30s, that would that have they gotten it to the point where they know, as we say, 10 years prior, would that still have given reason? Well, nowadays it would give reason for him to be tested earlier because of her having that breast cancer with the BRCA gene.
Exactly. And it gives the insurance companies, it gives your provider, like these are clues that we need in order to know how to help you manage, and make decisions around your health. So breast and prostate cancer run in families. And so knowing your history can save lives for both for both the men and the women. And it's really important to have that conversation. And most of us in Black families, we do not have that conversation. We do not talk about what grandma died of and what granddaddy died of. We just say that they died, we just know that they died. But we should have that conversation. And sometimes people just didn't know. They just, people did just pass away, and we don't know what they passed away from. But we should, usually there's somebody, let me say that, that does know. There's always that one person in the family that know all the things. They have all the tea, all the tea. They know all the tea. So get to that person. Usually it's the oldest person because they like, shoot, I'm about to be out of here. Let me just tell you all the things. So they'll just tell you. And as the person, I always family genealogy. I always one that was at the feet of the elders, listening to the stories and taking them down and things like that. So I know a lot because of that. And that's the experience that I think a lot of us don't have these days. I encourage you to do that though. Our elders know a lot, just in general, but they also know a lot that we need to know from them as a family, but bloodline wise. And this is one of them. What did people pass
Def-
away from? What did people, and not just pass away? What did they beat? Maybe they beat cancer. Maybe
Mhm.
it's other things that they passed away from. But we should know that. We should really learn that.
Definitely. And again, the thing to know, there's some holidays that are coming up. We're in the middle of a holiday now, but there's some holidays that are coming up, family gatherings.
Hmm.
It's important to start asking those questions and maybe challenge the young ones that can run around and with their phones and record things. That I would get lost and I would never find the recording again. But but to get the young folks in the family to get this family health history down. I know, would you lose it too? I would. Yeah, it's my kids just hand me
Yep.
the phone, mama. Just hand me the phone. Um, but
Yep.
yeah, so this is an opportunity when families gather
Hmm.
to start getting that information. And as we say, secrets kill. You have to talk about it, to be about it, and to prevent it.
Right.
And if we don't arm I love how you put it, if we don't arm our loved ones, our
Uh-huh.
siblings, our brothers and sisters, our family members in general, with these clues of what your doctor can then take
Hmm.
and know how to proceed with your health, then you're doing a disservice to the family. I know it may be difficult to talk about. Prostate cancer isn't something that's easy to talk about. Breast cancer isn't easy to talk about, but it could save a life if you talk about it. It could save a life, and it gives your children, your brothers and sisters, all of it gives your relatives an opportunity to be ahead of it and to be able to diagnose early. That's what's really really critical. Um, and knowing these links, like you said, Erica, and I'm so glad you brought that up. I had totally forgotten about that. The link between the BRCA gene and prostate cancer. We know the genetic link between for breast cancer, and people can get the genetic testing done to be able to see, do I have this gene. But it's very important that we do share this information. Milwaukee family, I ask you again, feel free to call in and be part of this conversation. 414-444-5253 or 414-444-5250. um, Erica, I don't want to lose, we talked about it a little bit, the heart health component and the
Yes.
importance of being heart healthy. And Mr. Ellis shared with us that after his diagnosis, he became vegan. Doesn't he does not eat processed food.
Right.
And Mr. Ellis, was that something easy to do overnight? You could just flip the switch and like boom.
No, and no, it wasn't something easy to do. It's basically
You-
you have to have a strong desire, and you take baby steps. So basically, what I did is I cut out red meat, is no more of those ribs, no more steak, and so forth. Um, then I started to eat more fruit, and so as time went on, I went without meat for like 3 or 4 months, and I said I can do this. So then I started making my own. In other words, I make my own burgers. I make my own bean burgers. I make my own veggie meals. I make my own salads. I don't use salad dressing, as sometimes I'll put a little bit of vegan mayo, which is a plant base, is just to get and the seasoning. What you
Mm.
have to understand with your foods, the seasoning makes your taste uh, buds and keep you going in that direction. My coworkers, sometimes they'll say, "We're going to Culver's. We're going." Uh, to Wendy's. No, I don't want any. And they was like, well, why don't you have some fries? Well, that's fried food. So, you know, so it's, it's a mind thing. You
Mhm.
basically have to be strong enough and say, no. Do I sometimes look at it and say, I would like to taste it? Yes, sometimes, but I don't taste
Mhm.
it, you
Mhm.
know. So what I tell people to do is take baby steps, change your eating habits, change your diet, don't mean you have to become vegan.
Mm-mm.
Mean you just start to eat healthier. You take instead of having, say, two pork chops, maybe have one. Instead of having a large steak, have a small steak,
Mhm.
and make sure you eat green vegetables with that, and
Mhm.
then you will see that it's going to help you. It's going to help your body. It's going to help you as an individual.
Mhm.
And as for me, as I just feel that I feel better, as I don't get tired, and one of the things, and another thing that I wanted to back up and talk about was a little bit of with radiation. Sometimes some people get very tired from it, but I would leave work, go and have my radiation treatments, go home, go to work the next day. At no time did it make me tired. So I guess
It's
it's that
individual.
individual.
Yeah.
And the other thing is, I want to tell the people out there, get your PSAs checked starting at 45. If you have cancer history, maybe you need to get it checked much earlier and so forth.
Mhm.
Sometimes you with your insurance companies, if you have the history, let the doctor know, and they will then get them to pay for it. Otherwise, most insurance companies say, "Oh, okay, 55. I mean, I'm sorry, 45 will pay for you to have your PSAs done."
Mhm.
That's some of the things that I'm hearing out there.
And
Mhm.
important again, that piece, if you know a family member was diagnosed, you
Right?
need to know the age that they were diagnosed, and then you subtract 10,
10.
and that
Yeah.
will be the year that you should start getting tested. So again, we're providing our family members with clues so that they know um, what they need to do,
Right.
and when they should start the screenings. But
R-
it's one of those things that you do. One of the reasons why we're doing the show is because we want people to have the information to be able to say, so this, I was listening to a show today and I understand that I'm 45.
Mm-hmm.
I should be getting this
I should be
tested.
getting my PSAs
Yeah, I should be
checked.
getting my PSAs done. Eric, I'm gonna go back to the heart health, and because and still that 1860 census tract piece
Mhm.
is still in my head, and we've got to, that it just it's just so obvious. It just kills me. But it's just, we've got to also talk about symptoms.
Mm-hmm.
So if I have high blood pressure, what are the symptoms? If I have heart issues, what are some of the symptoms? And are there symptoms? Can it go
Yeah.
unnoticed?
Yeah, it can be a silent killer as well. And some of the things that happen, I'm glad you teed that up for me. Some of the top three silent heart health risk are things like just hypertension in general, meaning that you just I feel it at times because I do have it as well. Where it seems like your nervous system just can't get rested. You're in chronic stress. So you and your cortisol, which is happening with your cortisol and your hormone is high. It increases inflammation. So stuff on your body starts getting bigger than it's supposed to. Blood sugar is high, blood pressure is high, and early screenings of that with your primary care provider is very helpful. The insomnia, anxiety, burnout, like you feel these things. Um, Sometimes you need to get a sleep study because sleep apnea is a big silent killer.
Okay.
Literally, it's obesity, high blood pressure, arrhythmias in your heart, and you're tired. You have insomnias. Sometimes it's connected to depression, obesity. You just need to again connect with your provider and figure out ways to help you have practical ways that you can manage it, because sometimes again it has to be customized to you, your lifestyle, things like that. And then getting routine blood pressure checks at the clinic visits, which is what we do, but also if you have a heart condition, you often can get a free blood pressure cuff from your insurance company
Mm-hmm.
that allows you to be able to check your blood pressure at home and then be able to share those results with them, and then they able to help you manage yourself in your own personal environment. So there's just a lot of ways to again, the partnership with the provider, the primary care provider is key to all of this because you need that help to understand what is going to work for me. It may not work for the next person, but I need to know what's going to work for me in order to get that done. So yeah, there's silent killers. That sleep apnea is a pretty big one.
Mm.
And it's one I think we just kind of like, oh, they just snore. It's like, they're snoring. And then there's like, you stop breathing.
Yeah.
Like, I know you stop breathing. And so I'm of the age and stage now where a lot of my friends have, they have sleep apnea. And then they've gone to get studies, and now they have a CPAP that they wear at night in order to, for their sleep and things like that. And that's a real thing. And we have access to those things if you have health insurance. If you don't, then I think there's still options for you available. But just pay attention to that. Like somebody just snoring, that may not be just snoring. There may be more things that's going on in their body that needs to be, addressed. So you should really make your way to, to your provider. The regular blood pressure should be like 120 over 80. That's a normal one. Elevated is 120 over, and it's higher than 80. High blood pressure is between 130 over 90. And so that you're starting to get into the high blood pressure area. And then there's critical numbers after that. And so that just means that you have to, there's medication that may be needed, at least initially. Definitely lifestyle changes. We talked about food and exercise. And exercise could literally be, let's go walking for like 10, 15 minutes. Like just, go somewhere. I often go to the lakefront, and I go over by the kite shop over there. It's my favorite spot. And then I'll just park, and I just walk up and down, just walk up and down there, get in my car, and I'm good. Like I like beautiful places. Milwaukee, I will say this, plug for Milwaukee County Park System. Milwaukee County parks are beautiful. I have traveled to many places throughout the country and throughout the world, actually. And there's nothing like it. Milwaukee County has some beautiful parks. McGovern is the other park that I go to. Lincoln Park is actually near the clinic, so I go over there as well. But like literally park the car, get out, take that walk, get back in and go about your day. But even that 15 minutes of just walking, and like I think about it too, it's the blessing of being able to walk.
Yes.
Mobility is a thing. And if you're able to do it, don't take it, don't discount it. That's huge. It's huge. I mean, I ain't be able to run, but I can walk. And I ain't trying to run, but I can walk. I can look at the beautiful people that can run. Yay. But I'm gonna walk. I'm gonna meet you at the finish line. I'm gonna be there in a minute. It'll take me a minute to get there. But it's a thing where we have to not discount the blessings that we have to be able to walk. And let's just take and the fact that God gave us the ability to have that as an exercise, as something that could just be enough to make a difference for us to live here longer, along with the heart health. So these are things that we would like to be able to invite people to do. I would love for churches or any other group to community together to do walking clubs. Literally, let's meet up on Saturday morning and let's just walk for 30 minutes and everybody go about their day. Like whatever that looks like, as a community, doing this work together is possible. And I would venture to say it's necessary to do it together from an accountability standpoint, because if you don't see somebody, and that's the other thing, we got to start checking on each other more. If somebody don't show up and they're supposed to be there, somebody better get to calling, doing a home visit, like whatever needs to happen. Because we got to get back to that. That is something that we don't often do. And we can go days with people not, knowing where someone is, and they could not be here with us anymore, but like be alone. So we have to be paying attention to that kind of stuff. So that heart health piece it's which is why I appreciate being a part, being able to co-lead this particular coalition, because it's something that impacts everybody. It literally impacts everybody. And it's about us having access to our healthcare. So as a provider or a person that owns or provider of healthcare, as well as a person that's from this community, born and raised. My mother's house used to be where on North Avenue, where the bridge is. That's where her house used to be.
Oh, wow. Okay.
And so that says from, we talk about, divestment of communities and that highway getting the impact of that highway through the middle of their city. That breaks up families. That broke up families. That broke up access to healthcare, broke up access to, good food options. We just had 5 grocery stores closed. Major parts of our city. And guess what those those grocery stores had? Pharmacies. So
Yes.
now you don't have, you
Yep.
don't have access to the food easily. You also don't have easy access to your medication, and
Right.
those go
Right.
hand in
Right.
hand.
Yeah. Yeah. It's so true. And I think you said so many key points in there. And I think one of the pieces, when we talk about heart health, it's the beginning of the foundation of building that relationship with the provider and the importance of building that relationship with the provider. I always use the story. There was a woman that I ran into at a health fair many, many moons ago, and she had not been to the doctor since she gave birth to her 20 some year old daughter.
Oh my God.
She had not been to the doctor. And so that's part of our system is understanding, and I and talking to other cultures, it's yes, we like prevention, we think of it as prevention, but many people don't identify it. If my arm's not falling off, if I didn't fall out, I don't need to go to the doctor. But
Mhm.
understand that there could be silent killers that are going on
Mhm.
that you would not know about if you did not have that relationship. And being able to say, yeah, I see my doctor on a regular basis, and and being able to say, yes, this is my medical home. If something goes wrong, this is who I need you to call, as opposed to just showing up in an emergency room and not having that primary care link to do full follow-up. um, and I think when we look at prostate cancer screening, which we are so grateful for the partnership with Health Connections and WDL to be able to do this and bring it all throughout the community. But if you look at prostate cancer screenings and look at breast cancer screenings, and
Mhm.
Wisconsin has the Well Woman program, which can
Right.
help support individuals who don't have insurance with those screenings. Understanding that there are resources out there, so you should not stop or delay getting care simply because of payment. There are ways that you can do it. We have, as you said, some free and charitable clinics. We have
Mhm.
federally qualified health centers. There are a lot of organizations that are here and in our community specifically to promote health and promote prevention. And it might be inconvenient. You might have to take a moment.
Right. Right.
You might have to take an hour off of work or go early morning. Um, and the clinics and free and charitable clinics and the FQHCs and the other clinics that are out there, they try to put their hours so that it can accommodate those who have working hours, 9 to 5, or things like that. So it's very important to understand,
Mhm.
to take advantage of being able to access those services. Um,
Absolutely. And we have Saturday clinics too. So we try to get you all in. We know people work, and we're working too. So we know
thank
you
you.
can't, we have late clinics. Like we really try, to accommodate. And even like Milwaukee Health Department, North Shore Health Department, like we partner with them as well. And I'm even, like I said before, I'm on the City Milwaukee Health Department's Board of Health. And we definitely have after hours, and we're at health fairs. Like the
Yes.
things that we're doing is like we're going to do tomorrow. It's important to even come to those kind of things, because when we do your testing, like we give you get your test results. But even with the PSA, which again I appreciate that partnership as well. When we do PSA testing, those results, if you are a part of a health system that uses Epic as a electronic health record, those test results go right into your record. They're
Mm-hmm.
there. And so sometimes but they also come to us, and we also, as Health Connections, and we call you and let you know what your result is. And not only do we call you and let you know what your result is, but if that result is positive, we help guide you. We have a navigation program. We help guide you through the steps in order to get their care that you need at that point in time. And
Mm.
that's regardless of your ability to pay. And we'll help you figure out what's the best next step for you. So we tell people that in advance, because a lot of times people don't get tested, so they don't want to know if that's positive. One, they don't know want to know the answer. They don't want to answer because they don't know what's going to happen next.
Yeah.
So they're like, you know what? I just won't get it done, and because I don't have support systems. Well, I'm going to tell you, if you get tested by Health Connections, you automatically have a support system. So that is not an excuse. What's next? Give me your arm. Let me wipe this off. Let's do this blood test. Because like, let's go. Because I'm that person. So, so like Mr. Ellis said, it is a blood test. I try to say that multiple times that the the initial PSA test is a blood draw. It is a small blood draw. It is not a digital test that it used to be initially. It is a blood draw, and we go from there. But please do not deter yourself from doing that. And the early age you had mentioned earlier, Mr. Ellis, the earliest I think that insurance companies will test is like for PSA and pay for is like 40, age 40. But to your point, Deborah, is if you know what age that the person that's related to you had it, like you said, do -10, and then that's when you should get started. So we help fight those fights as well as Health Connections. We are in communication with insurance companies, so we will do the paperwork and things like that to help make sure that you can get that test done and get it covered. And we do a lot of other things too. That's not just direct patient care. We do these other things to like really pave the way so that you yourself can get what you need and not pay for it, if that's available to you. So we do as much as we can to help you all navigate these systems. These systems are not easy. These systems are broken, and as we go on right now, they're going to be more broken. So this is why I'm telling everyone right now, my big PSA, if you will, public service announcement, not the other thing, is
Yes.
that if you have health insurance, you should get every test you can get that you're eligible for between now and December 31st,
Yes.
before your health insurance goes away, because we don't know what's on the other side. We don't know if I'm in Marketplace, for example, the amount that I'm going to have to pay for my premium in the future may be out of scope even for me. So I need to get everything I need to get. If that's a colonoscopy, if that's a mammogram, if that's a pap smear, if that's prostate, PSA test, if that's whatever you need to get it now. Do not play with this. Get it right now. And you should be doing that anyway, but you should really be doing it now. Like, we have some very serious, hard stuff happening in our government that may create additional insurmountable barriers. So we need to get it done now. Just get it done. I expect our phones, not just Health Connections, but Health Connections too. But I expect all of our doctors' phones to be ringing off the hook, because you guys are actually following up on that one.
Yep.
Right.
So you
Yeah.
got a follow up for the community. Get it done now. Okay.
That's your
So
call to
thank you.
action.
Call to action. There we go. We're going to take another break. Milwaukee, please feel free, family, to call in that number 414-444-5253 or 414-444-5250. We'll hear you on the other side. Welcome back, family. Welcome back again. We want to hear from you. The number 414-444-5253, 414-444-5250. You can call in, ask your questions, or talk about your experience. It was during the break. We again, I'm going to get Leonard on the show sooner or later. We were talking about some of the things that Leonard does to help keep. He is one of the coaches for our Men Moving Forward program, which has now we are so grateful to Milwaukee Rec.
Mm-hmm.
MKE Rec, Men Moving Forward is now available for $1 per week through MKE Rec.
Yes.
And you can actually start doing that program. Uh, and it's from what I hear from a distance, it's a lot of fun, but it's challenging. But it's talking about movement and the importance of getting to move. One of the things I my father, he had heart surgery, and when he was moving, we couldn't I didn't trust him to go outside, and so he would walk paces back and forth in the house. That's movement. Doing the stairs, make sure they're safe, but do the stairs, going up and down the stairs. That's movement.
Mm-hmm.
Don't let the weather in Wisconsin, although it's been very mild, um, but don't let the weather deter you.
Right.
One of the things I used to love is walking my dog out in the wintertime, because it was a little bit more challenging because of the snow and I had to put on all these clothes. But my dog would also go at a slower pace because he likes to play and rumple in the snow. But it's something that I was outside, I was
Mm-hmm.
working a little harder, and I was walking further with my dog just so that he would do his business and so he can go back inside. But it's one of those things that you think about is really important. It's movement. And so many of us, we were just talking about movies and stuff, but I can remember one weekend I was inside. I think I was sick though, but I binged watched Breaking Bad for an entire weekend. The whole entire, yeah, that was, even though I wasn't feeling good, that was not called for, and that was and it was a good series, but I that's we've gotten into that lifestyle because there's so much we can watch now.
Mm-hmm.
And I mean, if you have a job like mine where you are sitting at a desk, and there are days when I can have marathon meetings back to back to back to back, um, we don't get that motion. We don't move. And that is one of those. I also have high blood pressure. It's been under control for many, many years. But it's one of those things that contributes to high blood pressure. Um, the stationary lifestyle, the sedentary lifestyle, also contributes to our obesity, because often, and I'm guilty for this, when I sit and watch TV, I want my popcorn, I may want a soda, or I might get my flavored water, and I will eat while watching TV. And when you eat while doing that, you aren't really paying attention to what your intake is. And so watching our
Mhm.
diet um, while eating, and I think Mr. Jermaine and I were talking about some of the things we missed from when we were younger. One of the things I missed and was sitting around the table and eating, bringing the family together. And you sit around the table, you're not in front of the television, you're not grazing, you have an intent and a purpose. You eat, you might get seconds of something. My mother, it was always, you get seconds of whatever vegetable you want. She had limits. Um, but yeah, it was, we ate at the table, we talked as a family, and then we got up together and we cleaned up together and washing dishes in the whole 9 yards. But that's one of those things that you had amount of time that you were sitting, eating,
Mm-hmm.
that relationship building, and then you could go and do the rest. And sometimes my dad would get us and be like, okay, now we need to go mow the lawn. And I was like, so what? And then we're not doing, that doesn't sound like what we're supposed to, I'm supposed to watch cartoons right now, and that's not happening. But yeah, so and then we got our exercise in because we mow the
Mm-hmm.
lawn or we walk or whatever, ride our
Mm-hmm.
bikes, whatever, until what? The street lights came on, then you came inside. But it's
Right.
one of those things that I miss. And it does lead to us having higher risk levels because we don't have the movement, we don't have the practice.
Mm-hmm.
And Erica, if you can speak to that a little bit.
Yeah, sedentary life. Sitting too much actually weakens the heart. So
Yes.
every step, every stretch, every move we make literally helps protect our heart. Sitting too long makes the blood vessels stiff, and it raises the blood pressure because of that, and it puts a strain on your heart.
Mhm.
Poor circulation increases the risk for blood clots and strokes. Full disclosure, I had a blood clot, and it was a pulmonary embolism, and I literally
Oh,
don't say nothing, Deborah. I
oh,
actually drove myself to the hospital.
first of all, okay, I'm
Yeah.
not saying nothing. Not yet.
Okay, you can't say nothing now.
Okay.
But I went to my son was in first grade, and he had a program that evening. So me being I got off work, I went to closed the clinic early, went to go to his program, did all the things. Um, and as we came home, I was driving and I was like, I thought it was just heartburn, like just something I just ate something that didn't work, but it had been for several weeks. I didn't pay attention to it. So then as we were driving, I was like, and I usually did something. I said, okay, if I lift my arm a certain way, it'll go away. So I just lift my arm. I couldn't lift my arm. And I was like, oh, well, now if the workaround doesn't work, I know I'm not going to make it up the stairs because I live upstairs. So I wasn't going to make it up the stairs. I said, okay. And I tried to be calm. I was like, okay, honey. So I'm going to drive us to the hospital. I'm going to need you to go in and tell them that I need them to come out and get me. And we're not going to be crazy about this. He was like, okay, mom. So parked the car. We got out. And as I'm walking really slowly, when he went in and got him, they threw me into a chair and we did all the things with him sitting there. And so
Mm.
I will never forget that, because that was my warnings were weeks before that, and I did not pay attention to that.
Mm.
And then it turned out to be a pulmonary embolism, and I was in the hospital for several days. And so like it was crazy, and it was very it was scary because I had literally, I'm like, how did I get this? Well, before that, I had sat for hours, to your point, and I was writing a grant,
Mm.
a major
Mm.
grant, and I
Yeah.
sat for hours and hours, and so that just that contributed to it. So that's just a real life example. Again, trying to be honest about what can happen here, and just like a real life example of like this can happen to anybody. So blood cholesterol and blood sugar, um, having muscles burn less glucose if you're sitting for so long. So you have insulin resistance. It leads to higher risk for diabetes, and it doubles your risk for heart disease. Weight and inflammation, belly fat, weight gaining weight. Your blood vessels are damaged by that plaque buildup. So you want to make sure that you're drinking more water, you're moving around, you're getting your blood flowing, and cardiovascular fitness decline. So if you're not moving around, your heart muscles are less efficient. They don't
Mm.
get a chance to pump at a regular pace. So you're high risk for heart attacks, heart failure, early death, things like that. So again, every step, even just stretching, like do something, just move your body. It's a beautiful instrument that God gave us, and we need to do our best to make sure that we're taking care of it. And they could be as simple as just sitting. Who is that? Silver Sneakers.
Yes.
Yes, yes.
Yes, I thought about
Oh,
Silver Sneakers. So having Ebenezer and Miss Valley, and just being able to just sit in the chair and do the movement, like just
Yes.
whatever you can do, you just need to do it, and do it every day. Just every
okay.
day. That's all.
Yes. And someone in the chat, Miss Happiness
Oh,
Donuts is saying, yeah, she got on you. She was like, weeks, Miss Erica,
yes,
weeks.
ma'am. Yes, I
Yeah.
did, and I just kept, because I was so busy with my life that
Mhm.
I just didn't pay attention to it, and we have to pay attention to it. That is not acceptable, and I agree. And so now I pay attention to all the things. I probably see my person, and because I own a clinic, I'm also in there like, hey y'all, so this just happened. Like I'm always asking about all the things. I definitely take advantage. I'm not even playing. If patient
No,
doesn't show up, I will show up, and I'll be like, okay, so the latest episode.
it's-
So
okay,
now
the
I'm
grant.
on it. I promise you. I am on
Good.
it. I am on it. But I think we all need to be in that type of relationship. But yeah, we got to move around. That sedentary life,
Mhm.
it is probably one of the, again, you talk about a silent killer. That's one of the things that people they don't put it together, that how can this kill me, in my heart disease? It impacts you directly. because your
Yeah.
heart muscle does not get the pumping and the exercise that it needs. And so if
Right.
you're just sitting there, your extremities, people get, big ankles, like you're like, my ankles are swollen. Well, you haven't moved around enough. And it
No.
doesn't take a lot. It's just get up and go get that, put your printer way back in the back and just go
Mm,
get up and go get your stuff.
mm,
Just
yep.
it could be simple. It could be simple movement.
And that's the thing. Even when I sit in the office, I think about back in the day when I first started working, and I was saying, we don't. We didn't have email. You
Mhm.
actually got up from your
Yeah.
chair and your desk and you walked over to somebody and said, do you have a few minutes to talk about this? Yeah. And it's just a totally different landscape. And again, in the chat, thank you for sharing. Miss Happiness Donut sits a lot for work and will move more. And one of the things I do, my watch, and you don't have to have a Fitbit watch or anything like that, but if my watch, I set an alarm, and you can do it on your phone. That for every 15 minutes, you need to get up and move. And I have a standing desk, and so my desk I can elevate it so I can stand and work. Yes, yes, and so I can do that, and I try to get up, and I'll be standing, but I'll be moving my legs at the same time, just to make sure that I'm circulating the blood through my legs. But it's one of those things we have to catch ourselves with all the
Mhm.
conveniences that we now have. We still have to get back to the basics of being able to take care of ourselves. And part of that is
You're
the
right.
movement.
Right.
And I always, so whenever I have one of the griots on, I always have to ask this question, because as Mr. Ellis mentioned, when he started with Men Moving Forward, he said he was gonna at the end of 16 weeks you'd be able to do 50 push-ups.
That is correct.
So how many push-ups can you do now?
How many push-ups can I do now?
Yeah.
Well, at the end of the year, last year, we did um, uh, 13 sets of 34 push-ups. That was in the matter of about 34 minutes.
Erica, you doing the math for me? The 13
I
times.
am. Because you already know that my brain was like, yep, 442.
Yes. So then
Wow.
for our birthday, each time your birthday comes, you have to do your age. So I'm 73. I had to do 73, but there again, my ego jumped in and and I did 150 straight.
Wow.
Yeah,
I can't even imagine.
I
Oh
So
my
know.
goodness.
Thank
so
you.
this year, I think one of the
73.
things that we're
73.
going to do is we're going to probably do 10 sets of 55 for the end of the year.
Wow.
That's
Jermaine,
that's
you up for this?
that's
You
the
gonna
plan.
do this, Jermaine? The 10 sets of
10
55.
sets of 55.
Wow.
Yes, that's the plan. But what you was talking about, heart illness and so forth. My baby brother was 32 years old, and he was at work, and they was working off of a barge, and they had to go up this hill, and he was in very fit condition, we thought, and everybody thought. I mean, he was very buff, and he had a massive heart attack, and the doctor said by the time he hit the ground, his heart had exploded.
Father.
Yes, and
Oh,
so you
goodness.
never know, and that's why
So
basically it's so
sorry.
important to take care of yourself. Like you said, if you have health care, if you don't have health care, find some place that you can go and get
Hmm.
regular checkups.
And there are too many clinics in Milwaukee.
Oh
To me,
yeah.
especially again, I'm going to go back to it, especially in that 1860 census tract, you have Milwaukee Health Services sitting in the center.
Mm-hmm.
And it's that census tract
Mhm.
is so critical, but you have options and opportunities. Health connections right down the street. I mean, it's easy to get to them, and health connections is in the community. And like Erica was saying, you can come tomorrow at Calvary Baptist Church and you can get your blood pressure checked beginning at
Mhm.
12:30. I know they won't turn you away if you have to get there a little bit early, but at 12:30, there's plenty to do. Plenty to do. They're
Yes.
going to give some awards to their partners who have been supportive of this program. Um, but it is so important. And then you can also, while you're there, talk to her navigator, talk to some other clinicians that are there from Health Connections, and they can help you find that medical home. This is so critical. Having that medical home is just the start of your prevention. It's just the beginning, because you can't. I always used to, my mom, I teased her. She was having a stroke, ended up with triple bypass surgery. And she laid on the sofa um, downstairs, which was odd because she always went upstairs with my dad. And she was laying on the sofa downstairs. And my dad was like, "You coming up?" And she was like, "No, I'm going to lay here for a minute. I'm a little dizzy." And she did this for 3 days. And my dad finally was like, "What exactly is going on?" And she was like, "Yeah, I think I need to go to the hospital." And she needed triple bypass surgery. And it's just something that you just don't,
You don't
we are
expect.
so used to ignoring it because we got so much other stuff to do. And especially as women, we are so, we got to take care of the family, or as men who are taking care of the family. So we put it aside. But we can't do that. We can't do that right now. And we have a caller on the line. Erica, welcome, family. Welcome to Your Health and You. Go right ahead.
Yes, this is a great show. I really appreciate it. Thank you. Also, I want to make several comments. Can you hear me okay?
Yes, sir, we can.
Okay. Can you talk a little bit about the role of a person's primary doctor? Because in the African American community, there is a disconnect between what your primary should be doing and what kind of questions we should be asking, because so many of us use the emergency room as our doctor.
Yeah.
So
No,
can
you shouldn't
you
do
so
that.
so can you explain a little bit what persons should be getting from a primary, or in the clinic, in the community clinics? A lot of times you'll see a nurse practitioner
Mm-hmm.
who works with the doctor, that is there really for, I call it emergency type situations. But I think people need to understand that they have control over their health care.
Yeah.
They
Yeah.
they really do. And I'm speaking as a gentleman that's 68. I've been a transplant patient for 5 years now. So I'm a big advocate about movement, exercise.
Awesome.
But what got me through was the knowledge and working with certain patient navigators or people that are knowledgeable about the medical field to teach me about the right questions to ask a
Yes.
doctor, or whoever your provider is. I'll hang up and listen. Thank you.
Thank you so much, caller. And
Huh?
Eric, please jump on. So first of all, we are so blessed in Milwaukee, in Wisconsin. Nurse practitioners can be primary care providers.
Yes.
So that is a big plus. And we have another caller. I'm going to first let Erica. Can you answer the first
Correct.
question with regards, and then
Yes.
we'll get right to you.
Yes, absolutely. So thank you for the question. Yes, and I'm glad you said that, Deborah. That nurse practitioners, our medical director happens to be an MD, but our primary care providers are nurse practitioners on purpose. I'll tell you why real quick. Nurse practitioners get trained differently. Their training is to be very comprehensive about what's going on with you at home, that's how we create comprehensive plans for you. So I am intentionally only employ nurse practitioners in my clinic. So they are fully licensed to be able to do exactly what MDs do. So just FYI on that. Thank you for being an organ recipient and telling us that, because tomorrow we will have at Versity, we have a panel discussion of organ recipients. Richard Lewis, Darlena Johnson, and Lakeisha Myers. All of them are Black Greek leaders in Milwaukee. They will be talking about their own personal journey with being an organ recipient. So please come and hear their story. They're powerful. So please come. 12:30, Calvary Baptist Church, 2959 North Titonia. Free, open to the public. You get fed and everything. Anytime I'm involved, just so you know, you're gonna get fed. Just FYI, just how my family. That's how we got culture. We gonna eat. We gonna eat. It might not be
Yeah.
vegan. It'll be something though. Sorry, I'm Mr. Ellis.
She was
She's
reading my
reading your
mind.
mind. Reading your mind. And also,
I already know.
we're gonna have another show to talk about the right questions to ask.
Yes,
That's come up a couple of times,
that's
but
a big yes.
it's. I always say you ask questions until you feel you are heard or they're answered,
Yeah.
and it may not be what you want to hear, but it is what you have to hear. And so that's really important. And the other thing is, like, to always ask the question, like when you
Mm.
were getting your treatment for your prostate cancer, what are my treatment options?
Yes.
So that is
All of
also
it.
key. So we will have another show on that. I want to get to the other caller before we're about to run. You all wait to the last minute. We're about to run out of time. Caller, go right ahead.
Good morning. Excellent show. Can you hear me?
Yes, ma'am. Yes, we can. Thank you.
My question is on how do you um, get over when you have family members that go with no one knows the day or the hour. So they keep family medical history from you. I don't think it's done intentionally, but I don't
Mm-mm.
think that they so much care about it. My grandmother's still living. And if you try to talk to her about different things, all I get is, child, it was so hard back there. I don't know. I don't know. And I'm like, okay, grandma. So I try to keep up with things that's going on with her current medical history.
Yes.
And then my dad, he's a over exaggerator. You know, I want to have my test done today. I had the PSA this and this and that. It's like, okay, Dad, but you're fine. There's nothing wrong. You get that. And then my mom, she's healthy. So how far back do you go as far as trying to document family history? Two, what are some strategies for the family members that do the Bible verse of no one knows the day or the hour? And then three, thank you for the encouragement because I just bought a comfy computer chair and I got my breakfast in front of me and it's just so easy to get content. So thank you for the motivation to get up and move more.
Thank you so much, caller.
Great show. Great show. Have a great weekend,
Thank
everyone.
you. You too.
Thank
You
you.
too. And we
Thank
hope to see you at
you.
Calvary. Erica, the family members that I mean, God bless. Totally understand the scriptures. However, we need to know. I will tell you a trick that I did with my dad because my dad didn't like to talk about it. I told him I could probably help him manage his care. And so he was like, oh, okay. So then he put me as a person on all of his doctors that they could talk to me. And so when I said, I will help you do this, he was very open to doing it. Now, my dad was in his 70s, late 70s. And so he was like, he didn't want to bother with it anyway. And he would always say, well, tell my daughter, she can tell you what I do. But so that was one thing I did. But Erica, what recommendations do you have for those family members that are hard, just don't want to tell you? What would you say do? And I think we can't hear you
Power
for
of
some
attorney.
reason.
A lot of this is
Oh, there we go.
you. Oh, sorry.
Yeah, you're good.
Can you hear me now? You definitely want them to
Yeah.
be ask you to be on their power of attorney. Like you want to make sure that you're on their records. And also, this is slightly different but related as well. You also want to see if you can be a signer on their bank accounts. You want to make sure that you're like this is part of, and this should be another show, Deborah. I'm sorry, I just got to put that out there. The end of life planning. End of life planning. We really have to talk about that. I have a whole situation around and resources around that, advanced planning documents, so that we know, even in the provider's office, who do we call if there's something going on with you that we need to relay to someone else in the family. So you should really get your family to be a power of attorney, but do it in a way that's like they can take it. They can understand that there's a conversation here. You're not trying to take over their life. You're just trying to help them through and just be a true help to them. So you should really know what's going on, and that once you get access to the medical records, there's a release of information document that we have you sign. As with that being the case, you all get access to the medical records, and you can talk to the provider if they give you permission. You can talk to the provider directly yourself, and you should go back as far as you can go, because you just never know. There's always these clues, again, the breadcrumbs that we need to know how to take care of your loved ones for as long as possible.
Awesome. Yeah. And this is definitely, you are right. This is I have like 6 more shows off of this one conversation that we need to do, 6 more topics that we need to do. And we want to get to them.
Yes.
So again, family, this has been an incredibly enlightening conversation. First and foremost, we need to see you tomorrow at Calvary Baptist Church. Health Connections, you can get your blood pressure done. There's going to be food. There's going to be good conversations from guest diversity about organ donation. And it's really important that you be in the place to learn more. Erica, I'm actually going to put some stuff together to drop off for the fair tomorrow, including a sheet that we have for family health history. So if you want to
Yes.
figure out a format of how to collect it, I'm going to drop off so it'll be available there. I won't be able to get there until later, but it's so that you will have it and you can take this to your family as we get together. So the key takeaways: check your blood pressure, know your numbers. Your numbers include your PSA. If you have not had a mammogram, please go get it. This is Breast Cancer Awareness Month. We need you to be around. And as Erica urged, because of some things that are going on, try to get all of this done before the end of the year. Make this your Christmas present to yourself. And also, you need to make sure that if you do not have a medical home, that you can't go. You can do it at Calvary tomorrow. You can find a medical home with their navigators, or you can contact them directly at 414-999-1099, and they can help you. Family, this has been a wonderful time with you. We appreciate you, Mr. Ellis. Thank you so much for joining us.
You're so very welcome.
Thank you. Thank you. And Miss Erica, we will see you tomorrow at Calvary Baptist Church. Milwaukee family, we will see you tomorrow and we'll see you next time. Have a blessed weekend.